Welcome to another explainer. I am absolutely thrilled to have you here today. So, right now, inside your body, there is this deeply complex, totally silent system at work, literally trying to repair every single bit of wear and tear you sustain. But what happens when that system starts to slow down? Well, today we're diving into the ultimate biological investigation. We are unlocking the science behind IV stem cell therapy, and we're going to explore exactly how modern medicine is harnessing the body's natural healers to reverse damage and combat disease. Here's our roadmap for this explainer. First, we'll look at aging. Here's our roadmap for this explainer. First, we'll look at aging and physical decline, then how IV stem cells actually work, followed by healing naturally, the benefits of regeneration, and finally, strict safety standards. By the end, you'll have a rock-solid understanding of the rigorous science making this therapy both safe and effective. All right, Section 1, Aging and Physical Decline, or the fading power of our natural repair system. Let's start with a universal truth we all face. Our bodies simply do not bounce back the way they used to, whether that's from a sports injury, an illness, or just, general fatigue. So I want you to think about this for a second. Why do our bodies lose their ability to heal as we age? Think back to when you were 10 years old, right? A scraped knee or a paper cut would heal in just a matter of days, literally vanishing. But today, that exact same cut takes way longer, it hurts more, and it might even leave a nasty scar. So what actually changed inside us? Well, when we look at a comparison between fetal tissue and aging tissue, the difference is honestly staggering. Fetal skin has this unbelievable capacity to heal rapidly and without leaving a single trace of a scar. It's basically a perfect repair mechanism. But as we get older, our internal repair system just gets sluggish. We heal slower, and our bodies sort of just patch the damage with lasting scar tissue instead of fresh, perfect cells. We used to have that flawless repair mechanism, but it just kind of fades over time. So, the crucial piece of the puzzle is understanding what powers that youthful healing in the first place. And the answer? Mesenchymal stem cells, or MSCs for short. Now, these are multipotent cells, which is a fancy way of saying they have this immense power to renew themselves, and they can transform into unique, specialized cell types to repair your connective tissues, your bones, and your cartilage. They're basically the missing clue in our biological mystery. MSCs are the universal building blocks responsible for that amazing scarless healing we were just talking about. Moving on to Section 2, How IV Stem Cells Work, exploring the microjourney of natural regeneration. Let's trace their path and see exactly how we use these universal building blocks to fight aging and disease. The process of IV stem cell therapy is truly this incredible microjourney. It starts with an intravenous infusion, administered super carefully, usually at a controlled rate of about 1 cc per minute by a physician. During this time, over 300 million stem cells are introduced directly into your circulatory system. Now, once they're in your global bloodstream, they act like tiny biological detectives. You see, damaged and inflamed tissues actually send out these chemical distress signals, and MSCs are uniquely designed to sniff out those signals. Once they arrive at the site of the damage, they roll up their sleeves and get to work, repairing the tissue, calming the inflammation, and replicating to restore your cellular health. Take a look at the visual evidence of what these healthy MSCs actually look like. Do you notice that distinct, elongated spindle shape? That right there is the hallmark of a really healthy, potent mesenchymal stem cell adhering to a surface. These specific cells are derived from fresh umbilical cord tissue, which happens to be the youngest and most highly concentrated source of MSCs available anywhere. Because they're day one cells, they have maximum vitality. They're completely ready to get to work as your body's universal building blocks. Now contrast those fresh, spindle-shaped cells with these senescent cells, which are basically aging, damaged cells. Looking under a microscope, you can see they're way larger, they're heavily degraded, and they're filled with these massive vacuoles. They've been stained blue here just to highlight their aging state. Honestly, these cells have essentially given up. They can't divide or repair your body anymore, and they actually actively contribute to inflammation. And this is exactly why a fresh infusion of MSCs is so absolutely vital. We need young, vibrant cells to step in and replace these tired, blue-stained ones. Okay, Section 3. Healing naturally by replenishing your biological toolkit. Now, I really want to reassure you here, we are not talking about pumping synthetic foreign chemicals into your body. This therapy is fundamentally just about replenishing your own biological toolkit. I absolutely love this metaphor from the research. Stem cells are the body's invisible first responders. Just like paramedics rushing to the scene of a bad accident, your stem cells have been working silently behind the scenes from the moment you were born to repair damage and keep you healthy. By utilizing IV stem cell therapy, you aren't doing anything unnatural. You're simply giving your body a massive reinforcement of paramedics to handle the wear and tear that's piled up over the years. Of course, the purity of these first responders is absolutely paramount. The stem cells used in top-tier treatments are derived from fresh umbilical cord tissue, which, again, holds the highest concentration of MSCs. And they're sourced non-invasively and ethically, strictly from healthy C-section births to make sure there's zero contamination during harvesting. Plus, they're cultured xeno-free. This means there is absolutely no animal or bovine serum used in their development, which completely eliminates the risk of animal-related allergies or immune rejection. They even use phenol red-free media to promote the highest possible cell survival rate. The whole extraction and preparation process is as pristine and natural as modern science allows. Which brings us to Section 4, the benefits of regeneration, looking at systemic healing and anti-aging. So now that we know how these cells work and where they come from, what can they actually do for your day-to-day quality of life? Let's talk systemic healing. Because IV therapy circulates these cells throughout your entire body, the benefits are incredibly widespread. For anti-aging, MSCs release natural antioxidants to fight oxidative stress, and they even stimulate the creation of new blood vessels, literally giving your skin and organs a new lease on life. For neurodegenerative diseases, things like Parkinson's and Alzheimer's, they offer immense promise in protecting and regenerating neural pathways. In autoimmune disorders like MS and lupus, these cells possess powerful immunomodulatory properties, meaning they can actually calm down a hyperactive immune system. And for orthopedic issues, they migrate directly to inflamed joints to repair cartilage right at the root source. It is a completely holistic approach that treats the underlying damage rather than just putting a Band-Aid over your symptoms. And hey, you don't just have to take my word for it. The World Health Organization itself has stated, regenerative medicine, including stem cell research, is among the most promising fields in modern healthcare. That is a massive validation from literally one of the most trusted medical institutions on the planet, anchoring these incredible cellular therapy claims in globally recognized science. All right, our final section, Section 5, strict safety standards, specifically strict laboratory validation and safety. I know exactly what some of you might be thinking right now. With any cutting-edge treatment, there are always concerns about regulation, right? So let's tackle those Wild West fears head-on. Safety always starts in the lab. Notice the technicians operating in a highly sterile Class 100 cleanroom, performing super careful microscopic verification using advanced flow cytometry to check the stem cell markers. Without these rigorous, incredibly sterile conditions, stem cell treatments run a very high risk of bacterial infection or immune rejection. The environment has to be utterly flawless to ensure that the cells remaining are pure, potent, and safe for human infusion. And laboratories don't just get to claim they're clean, they have to prove it. A certificate of compliance for ISO Class 5 cleanroom standards, which is equivalent to a WHO Grade A cleanroom, is the absolute gold standard for producing purified medications for injection. Having this physical proof guarantees the total purity of the cells being cultured, ensuring that absolutely no pathogens or contaminants ever reach the patient. Furthermore, the cells themselves undergo rigorous testing based on the ISCT minimal criteria for MSCs. The International Society for Cell and Gene Therapy established these global standards. For a cell to legally and scientifically be called a mesenchymal stem cell, it has to adhere to plastic, it must test positive for specific surface markers like CD105 and CD90 at over 95%, it must lack other specific markers to prove it's not just a standard blood cell, and it must successfully differentiate into bone, fat, or cartilage in the lab. This ensures you are getting exactly what the science promises, no exceptions. So the crucial takeaway here is this. There is zero guesswork involved for the patient. Prior to your infusion, top-tier clinics provide a Certificate of Analysis, or a COA. This document literally guarantees the standard, the viability, and the exact quantity. We're often talking hundreds of millions of the stem cells you're receiving. It's complete transparency and a solid guarantee of the quality you're trusting your body with. So, we've covered the fading of our natural repair systems, the absolutely incredible microjourney of IV MSCs, and the rigorous global safety standards that make all of this possible. So I want to leave you with this final thought. If you could turn back your biological clock and awaken your body's natural healers,